has, sort of moved the ball forward on over the past couple of years in recent legislation and Medicaid coverage, for certified midwives. And I think you guys are just absolute experts in the field to really help our listeners sort of break all of this down.
Majority of women are not high risk. They should not be in the hospital. This is why we're having these unfortunate events, because there is a shortage. There's a lack of beds. Once you get in there, you get put on the clock. You have to either progress, or they're going to be essentially offering you Pitocin, which will artificially speed up your labor. And this is probably another reason why Black women are suffering disproportionately, outside of just obstetric racism that we see.
And that's why we looked at implicit bias training and some other items, because you can't leave behind women of color.
That's why our focus is legislation, because it's like whenever the movement passes, the gains that are being made now will benefit Black people, and then also it also benefits maternal health overall.
Everybody is saying, quote unquote, Black Lives Matter. And I didn't understand, and I'm very wise in understanding that Black people right now, like the Black maternal movement, it really is like, quote unquote, political capital, right? Everybody's capitalizing off of what's going on right now. But at the end of the day, like, who's going to actually care and stick with this 10 years down the line? When I'm looking at people that we have around us right now, are we going to still have the same people around us 10 years later?